Ozone is just utilizing ozone gas, or O3, and putting it into whatever tissue we decide to go with in particular. So ozone treatment traditionally is done through the blood, where we actually are drawing out about 200 mLs of blood at a time, pressurizing it with ozone gas, and then pushing that blood back into the patient's system. And each one of those rounds is called a pass. And so for a lot of chronic disease patients, we're doing up to 10 passes or 10 rounds of 200 mLs of blood. What this is essentially doing is this ozone gas gets into the blood. As it comes back into the blood, it has a very high cytotoxic effect. So it'll kill off pathogenic bacteria, viruses in the system. It also has some anti-inflammatory effects, so it really helps with wound healing and recovery. Athletes are doing it to some extent to really be able to decrease inflammation, increase their recovery time. A lot of patients with Lyme, chronic Epstein-Barr virus, mold toxicity are doing it to be able to purge any sort of pathogens in the system. We're also putting it into syringes and pushing it into the sinuses as well in order to treat chronic or recurrent sinus infections because of that cytotoxic effect. We're actually killing things off in the sinuses pretty quickly, and after between 1 and 4 treatments, patients who have had sinus problems their whole life, it's starting to go away if there's any kind of involvement with bacteria or fungal species present there. Ozone can be a great tool either in addition to or in place of things like high-dose vitamin C therapies through IV, or for patients with chronic or recurrent sinus infections who have tried round upon round of antibiotics, and it helps in the short term, but then it always comes back a month later, 2 months later, whatever it might be. So this is a good long-term treatment modality for a lot of people.